Good afternoon, everybody. Thank you for joining the Hispanic Chamber of Commerce of Montgomery County in a series of conversations with candidates to various elected positions in both Montgomery County and the state of Maryland. Today, we have the pleasure of being with Joe DeMaria. So Joe he's a community activist, diplomat, educator, parent, I'm sure many more things, Joe. Joe has worked as a contractor for the U.S. Department of State. He has legislative experience as a fellow with Majority Whip of the U.S. Senate, Rick Derming, and as congressional advisor at the Department of State. Joe has contributed to the drafting and passage of the Trafficking Victims Protection Reauthorization Act of 2008 and the Adopted Family Relief Act of 2015, among many other accomplishments in his lifelong career. So, Joe, good afternoon. Thank you for being with us today. It's a pleasure to have you here.
Well, thank you for arranging this, Mauricio. This is the third event I'm to with the Hispanic Chamber of Commerce, and you're a good bunch. I always enjoy them, and your outreach, bringing candidates to speak, has been fairly successful. And I've always enjoyed them. I'm always happy to meet with constituents and interested parties. My name is Joe DeMaria, and as Mauricio said, I am a candidate for the Maryland House of Delegates from District 17. That's Rockville and Gaithersburg. And the House of Delegates is the lower house of the state legislature. Now, I know that most of you, or all of you, are small business owners, and I want to say that I grew up in a family business. I started actually in 5th grade, cleaning my father's store, including the bathroom, once a week. That was my job. I think they gave me like $1 each time, but in those days, $1 went pretty far. And then when I was 14, as soon as I was old enough, he put me to work in the warehouse, loading and unloading trucks. Now, my father dropped out of school in 9th grade during the Great Depression to go to work. So he was a great believer in education because he didn't have much, but he was also a great believer in kids getting out there and working too, in their teenage years. So he made sure I was there not only during the summers, but every Saturday, school holidays, that Friday after Thanksgiving and all. And it paid off well, that experience working, because the family business closed when I was a sophomore in college. So I had to work my way through school for the next 2.5 years. And I graduated on time, and I've been financially on my own ever since. I worked my way through graduate school, where I was enrolled full-time as a graduate student, waited tables full-time, and taught part-time to make ends meet. And I've had a variety of other jobs when I was young. I worked to pay back my student loans. My wife and I paid for our own wedding, saved the down payment for our home. We have no car loans. We keep our credit cards at 0 at the end of the month. And we still work side jobs in addition to working part-time. So I'm saying that because I want you to appreciate 2 things. Number one, I know what working families in Montgomery County need from the state to make things a little bit easier for themselves. And secondly, I want you to get an idea of how I'm going to handle your tax money when I'm in Annapolis. Those experiences give me an understanding of what working families need. And there's a difference between what we know and what we understand. We know things that people tell us about or we read about, but we only really understand things that we've experienced or we've done. And I think my life experience mirrors that of the constituents of District 17. Now, Mauricio mentioned professionally, I'm a diplomat. I served in the U.S. Foreign Service for 26 years. And during that time, I negotiated free trade agreements, resettled refugees, managed a cost center, which brings in $18 million a year in government revenue, and oversaw a cost of service study for $2 billion in U.S. government fees. In addition to that, I have legislative experience. I've interpreted, implemented, and actually drafted laws. So I have some experience with legislation, although on Capitol Hill, not in the State House in Annapolis. I understand the Latin American experience, having lived and worked in Latin America for 10 years, including on the Mexican side of our southern border. And my spouse is Latina. We've been married for nearly 24 years, and she teaches Spanish herself. So I not only know what needs to be done, but based on 30 years of public service, I know how to get things done. And I'll save anything else I have to say for closing remarks. Any questions or comments?
What does the House do? Let's start with explaining our viewers what the House does and your role if elected as delegate.
Okay, the Maryland state government is set up pretty much like the federal government. There's a lower house, like the House of Representatives in Washington, and then up the Senate. The lower house is called the House of Delegates. In each legislative district in Maryland, there's one senator and 3 delegates. So in District 17, where I am, Rockville and Gaithersburg, this year, one of our 3 delegates is not seeking re-election. That's Jim Gilchrist. Our current delegates are Kumar Barve, Jim Gilchrist, and Julie Polakovich Carr. Now, let me just say right up front, if Jim Gilchrist were not stepping down, I would not be running. I have full confidence in the team we've got in the House of Delegates now, Barve, Gilchrist, and Polakovich Carr. I see no reason to replace them, but Jim decided after 16 years in the House of Delegates to move on and do something else. Now, like the federal government, the legislation can begin in either the Senate or the House, but it has to be passed by a majority in both houses. And then it has to be signed by the governor. If the governor vetoes legislation, then you need more than a majority to override the veto. Has happened a couple of times in the last legislative session. And don't ask me off the top of my head which bills, because, but it did happen a couple of times. So basically functions the same as the federal government. There's a constitution and, there's a budget. Now, Maryland is unique and very different from the federal government in that the legislature doesn't have as much control over the budget as does the federal government, the House of Representatives and the U.S. Senate, and the governor has a lot more control over the budget. The legislature can cut items from the budget, but it can't add things as it goes along to the budget. There's sort of a general budget, and only the governor can add new items once the budget is passed. So that's basically in a nutshell what the legislature does. The terms are in both the House and the House of Delegates and the Senate are for 4 years. They correspond with the term of the governor. So 4 years ago, we elected an entire House of Delegates, an entire Senate at the state level, and re-elected Governor Hogan. Governor Hogan has reached his term limits, so we'll be electing a new governor, no matter who it is, because of term limits. There'll be someone new in the governorship this year. And as a Democrat, I am hoping it's a Democrat.
All right. What are the main issues of your campaign platform that you want to address if elected as a delegate?
Well, the main issue, I agree with President Biden that the main issue is COVID-19. It's still with us, and we went through a tough 2 years. It may not be over yet. Let's hope it is. But we have to learn our lessons. We have to be prepared for something like this to happen again. In Maryland, the state government did a pretty good job. I think the federal government dropped the ball in a number of ways. But we really can't address our other issues until COVID is taken care of. Public health is very, very important. And what we need to do now is I just got a message saying my internet connection is unstable. So put it in the chat or signal to me if I freeze up. Uh,
It happened briefly, probably a couple times, but the message was still clear. If it
Okay.
happens, I will ask you to probably repeat the last sentence or so.
Okay. Yeah, so without going over what was done in the past, we have to learn for the future. There's going to be a lot of money coming. The state still has money for COVID relief, and there's going to be more money coming from the federal government under the infrastructure bill. I would advocate using as much of those resources as possible, first of all, in our schools, so that our schools don't become petri dishes for the spread of airborne infectious diseases. Schools, they're large groups of people, they're enclosed all day long. And when something like COVID comes along, they can really be the nexus for the spread of a disease like that. So the schools have to be upgraded. New schools, when they're built, have to have proper ventilation and plenty of space for social distancing. Secondly, the schools have to be ready, if necessary, to switch over to virtual learning again. I give plenty of credit to our school systems and to the teachers and support staff, and also to parents for adapting to virtual learning quickly. But virtual learning, going to school online is very, very different than going to school in the classroom, both for the students and for the teachers. It requires different equipment, obviously, and different methods that the teachers didn't necessarily learn when they were in college studying to become teachers. So we have to be ready on short notice to switch to virtual learning. One of the things that we found out during the pandemic is that, when we switch to virtual learning, not all students have access to high-speed internet in their homes, or even access to a computer, maybe. The way I see it, we can move to a model where computers can be lent to the students. They still belong to the school, but they're lent to the students to be used at home when need be. And the model is, if you're in a high school band and you decide to play the trombone in the high school band, the school gives you a trombone. The trombone still belongs to the school, but you take it home and you practice with it. And when you graduate, you bring the trombone back, or at the end of the school year. We could do that with laptop computers for the students, and possibly have an option for the parents to buy as they're replaced every few years by the older ones. That's very necessary. And also, access to high-speed internet. It's a utility. As President Obama said, it's not an option. It's something that you need. It's like a telephone, water, or electric. It's a public utility nowadays, and everyone should have access to it. So there's a lot we can do there to prepare in case there's COVID or something like COVID again in the future. And I would point out, this is a topic that means a lot to me, because my own mother died of COVID-19. She was in a nursing home, and COVID broke out in March. She died in December of that year. So we're lucky that we had an extra, 9 months with her. During those 9 months, I saw her 6 times. 3 times were for doctor's appointments, and 3 times were when they briefly opened up that September, and she was allowed to visit her once a week for a half hour. But a lot of people weren't that fortunate. It swept through the nursing homes like wildfire. And eventually, when it hit her, the nursing home she was in, they lost a lot of their residents. What really disturbs me, I have no sympathy for these no mask, no vaccine people. I think that they have reneged on their civic duty. They they talk about their freedom, you know, to not have a vaccine or not wear a mask. The point is, living in a free society is more than just freedom. It comes with responsibility also. And those people just did not live up to their civic responsibilities to help protect the country. And I'll give you a comparison. How many Americans died in the Second World War? Do you know? Anybody want to put it in the
How
chat?
many Americans died in World War II?
Yes.
No.
418,000. That's it. 418,000 over a period of 3 years, more than 3 years. COVID took 1 million American lives in 2 years. Okay. This was our World War II moment. And these no mask, no vaccine people didn't step up to defend the country. You know, it's a question of defending the country, and then they just refuse to do it. What really disturbs me is when I see the governors of Texas and Florida say that it's not their responsibility to protect their people from COVID, and actually use their powers as governor to prevent private companies and local school boards from issuing mask mandates or requiring vaccines to protect their people. You know, protecting the people is the reason why we have government at all. I'm a Hobbesian, meaning I sort of believe in the teachings of the philosopher Thomas Hobbes, who said, you know, without government, life would just be chaos. We'd all be at each other's throats all the time, in a constant state of war. And the reason we have government is to protect us so that we don't have to spend all day long fighting off our neighbors from our food supply. And, you know, what I see these governors doing is just, you know, shirking their responsibility to protect their people. If I'm in the state legislature, I'm going to make sure that the governor of Maryland has the authorities he or she needs to protect the public health, and make sure that he or she uses those authorities, which, you know, they can do. You know, the state is empowered to take drastic measures to protect the public health. So that's sort of my first issue. Stop me if I rattle on too long. The second issue is I'm very concerned with worker rights. When I was with the Department of State, I was a labor officer. When I negotiated free trade agreements, I was on the worker rights team of the delegation. So I'm very familiar with these issues. And I think that there's an awareness since the recession of 2008 of income inequality in this country, great income inequality, and a desire to do something about it. I think now that the economy and the workplace is restructuring after the pandemic, and with a very low unemployment rate, lowest in 40 years of 3.6%, now is the time to not just defend worker rights, but to expand worker rights and to promote them. You know, I was in a forum where they asked, you know, what I think about the minimum wage, what I think the minimum wage should be. And my answer was, you know, we shouldn't need minimum wage laws. We shouldn't have the state telling employers how much they have to pay. If workers had collective bargaining and they could negotiate their own wages, you know, no one knows a job as well as the person who does it. And workers are not going to drive their own enterprise out of business. They know what their employers can afford. They know what they need. And that should be, you know, rather than the state setting minimum wage laws, workers should be able to freely negotiate the terms and conditions of work with their employers. So that set of issues and those types of issues are of great concern to me.
We just learned in the news that an Apple store outside of Baltimore was the first Apple store to unionize in the country.
Yes.
Tell us a little bit more about the role of the unions in that sense. We know, general knowledge, the unions work to protect workers' rights. You've been a union worker, a union employee in the past. So tell us more about your experience and how unions can help play a role in bringing more equity for workers, especially those who earn low wages in our state.
Yeah, that's a good question. Unions serve to aggregate and articulate the interests of workers. For example, we have a nephew, a niece and nephew. They had a child a few years ago, and his company did not allow for parental leave. So he went to talk to his human resource manager about, can the people get, some more parental leave? And they shut him down right away. Well, of course, he's one employee, walks into the office, he does whatever his specialty is in the organization, goes in to speak to the human resources manager, who is an expert in labor law, an expert in the terms and conditions of work. And he asked for something and they shut him down. So I said, well, how many other workers want, more parental leave in your workplace? And he works for a company that has 10,000 employees. He said, I don't know. I said, well, what does your union say? Well, they don't have a union. Okay. The thing is, if you have a union, he would have been able to go to his union. The union would know like how many of the workers wanted parental leave, right? Or expanded parental leave, or whatever the issue was that he wanted, and be able to go to management with their own experts in labor law and their own experts in negotiating, and begin talking to management about that. So they would, as I said, aggregate, bring together the interests of the workers, and then articulate them, present them to the company. Because he's a computer programmer. What does he know about labor law and negotiating and stuff? That's the role that a union plays and should play. Now, that being said, in the past, 50, 60 years ago, there were some corrupt unions in this country. They kind of gave unions a bad reputation, but that was 50 or 60 years ago. You don't hear about that anymore. I would also point out that every union official in this country is elected by the rank and file, by the members. You can't, there are no CEOs that are elected by their employees. And lastly, and I've said this when I've spoken to unions, and maybe they don't like it, but it's the truth. The unions today cannot look like the unions of yesterday. The workplace has changed. It has changed because technology has changed. It has changed after the pandemic, and people got used to working from home, and more people teleworking than before. And it has changed because the younger workers want different things. They want something different from the workplace. They do not enter into, go with the company planning to stay there for the rest of their lives and make a commitment to the company. They move around. They prefer not having to drive to work long distances. I can give you a couple of 3 examples of how the workers themselves are changing. One example is the trucking industry has a shortage of truckers. So they looked into it, and they found out that the reason there's a shortage of truckers is that the younger, even though truck drivers make over $100,000 in this country nowadays, the younger workers don't want to be on the road for 3 weeks at a time away from their family, living in a truck, living in, as nice as they are, in one of these tractor trailers. So they're restructuring that industry so that instead of truckers taking off and being on the road for 3 weeks at a time, they have shorter hauls, and so they can be home every night instead of long cross-country trucking, which requires a whole reorganization of the entire industry to meet the desires of the workers and the demands of the workers, which means that the truckers union has got to change the way they do business also. They can't think the way they used to think when they were representing workers who were on the road for 3 weeks at a time. Another example I'll give you is I met a guy who works for Marriott, local company, right? They've got their world headquarters here in Montgomery County, where Route 270 meets the Capitol Beltway. But they just built a new headquarters in downtown Bethesda. If you've been through downtown Bethesda, there's a lot of construction there, huge. It's like Little Manhattan now with the big high rises. And I said to him, what do you think about moving the headquarters? And he said, do you know why we did that? I said, why? He said, and this guy works in data analytics for Marriott. He said, well, Marriott went out and they hired bunch of consultants. And what they found out is that the workforce they need in the next 20 or 30 years, who are in their 20s or early 30s now, the younger workers, don't want to drive to an office park out in the suburbs. In fact, they don't want to work in an office park at all. They don't want to drive to work. They want to be able to either walk to work or take public transportation that they can walk to and then walk to work on both ends, getting to public transportation, getting to the office. So Marriott moved their world headquarters, and it was very expensive, to a brand new building right near the Bethesda metro station, just to adjust to the needs of younger workers who demand a different type of workplace than older workers did. Now, if unions want to organize those workers, the unions have to start thinking differently and start having to do business differently and start addressing different types of issues to satisfy the demands of new workers. And with technology and teleworking and all, Americans don't work in factories anymore. Americans sit home and work from their laptop 3 days a week, increasing numbers of them, which, unions have to get their head around that. So yeah, unions are important, and they play a very important role, I think, and a constructive role, but they have to change and they have to adapt along with American industry going into the future. And I think that, there's a role for the state government to help industry and help the workers adapt to a new economy where things are done differently than they were in the past. Anyway, I may have spoken a bit too long about that, but it's a topic about which I have many ideas.
I think the explanations and the examples were great. What are your views on healthcare? You talk about COVID-19. Now, COVID brought a friend along, and that is a mental health crisis with us. And it's happening at all levels. It's happening with adults, but it's affecting particularly children. How can you address, as a delegate, the mental health crisis that we currently have in our country, and particularly in the state of Maryland?
Yeah, particularly with children, there was a report done called the Kirwan Commission, issued a report which resulted in something called the Blueprint for Maryland's Future, which addresses Maryland's education system statewide. And it found that there's a shortage of 15,000 teachers in Maryland. And there's a comparable shortage of school psychologists also. So, one thing is making sure that the schools have trained school psychologists, and especially bilingual, because there are a lot of, as you well know, Spanish-speaking students from Spanish-speaking homes in the schools, who they and perhaps their parents certainly would feel more comfortable getting those types of services in their native language rather than in English. The state can offer incentives for bilingual mental health professionals from other states to move here. They can, set up some kind of a bonus system for them to work in the schools, some sort of a tax incentive for the first few years if bilingual mental health professionals come to Maryland to work in those ways, and just making sure that the schools have the funds they need to have mental health professionals. If not in every school, certainly every school has access to mental health professionals. And also better training for the teachers themselves, because they're really the first line of defense. The teachers have to be trained how to notice when a child is under stress or when a child may be exhibiting symptoms of mental health issues, and then have somewhere to refer that child when they make that observation. And as you said, it's not just children, it's adults also. There's a TV campaign that you see now, which I think is just great, trying to help people overcome the stigma of asking for counseling or asking for help with not necessarily mental health like psychosis or something, but just the stresses of everyday life, which can become very stressful and can become a problem if they're not dealt with early on.
So you see yourself as promoting allocating more funds for public school districts across Maryland to support them in having mental health workers, social workers, psychologists, and all the resources they so desperately need to address these crises, as well as the quality of education in many of those districts.
Correct. Now, the thing is, though, there's a great disparity in the resources of public school districts across the state. In Montgomery County, we have a county-wide district. Montgomery County is a very affluent county. I just read someplace it's the 17th most affluent county in the United States, and there are like 3,000 counties in this country. So a place like Montgomery County may have the resources to do that more easily. They may need help attracting professionals to work in the school systems, but they would have an easier time with the resources. There are other school districts in other parts of the state that are not so well founded and well funded, excuse me. And I think that it is the duty of the state government to level the playing field, to make sure that all students in Maryland have access to a high quality education the way they do in Montgomery County, because, we don't live in an agrarian small town kind of society or economy anymore. We live in a post-industrial, interdependent, highly mobile society, so that the people you interact with every day aren't all from Montgomery County, and they're from all over the state, all over the nation. So it's up to the state to make sure that the less well-funded school districts have the resources they need to address these types of challenges.
And how can the state and the House of Delegates help support access to healthcare? We have so many people that don't have access to healthcare, and they don't have an option. And that has a direct impact on many of the things that you've mentioned, including COVID and many other diseases and many other problems that cannot be addressed unless you have access to healthcare.
Yes, I've gotten my 2 COVID vaccines and my 2 boosters, all 4 injections through the Maryland Department of Health. And I found it pretty easy and pretty efficient. And pretty easy to use. I didn't have to wait very long for any of those injections. And I went to them. I chose to drive, but I could have walked to the site where they distribute the vaccines. However, not everybody avails themselves of that. And there are health issues beyond COVID that people face. My position is everyone working in Maryland should have 4 things: a living wage, health insurance, a contract, and a pension. And health insurance is very important. It is not mandatory that all businesses provide health insurance to their employees still. That's why we have the Affordable Care Act at the national level, so that people can join the is it not cooperatives? What's the word they use for the pools of healthcare? It slips my mind right now. But anyway, they can go through the federal government and get themselves some health insurance. You can't live without health insurance. That's for sure. So more people having access to health insurance, everybody being insured, is good policy. It's not only good for the individual, it's good for society in general. Because what happens is when people don't have health insurance and they feel sick, they will wait until the situation becomes acute and they're desperately sick, and then they go to the emergency room. Well, treating an acute illness is a lot more expensive for the system, for all of us, than preventative medicine or treating an illness when it first begins. And emergency room services are much, much more expensive than being able to visit a clinic or visit a doctor when you first begin to feel symptoms. So actually, we end up paying for the uninsured. We all do, because our rates go higher. The hospitals have to be able to cover costs of people who are uninsured, and they pass those costs on to those of us who are insured. So there's a public interest in everybody having health insurance. And, there may still be some people out there saying, if my neighbor wants to go jet skiing and breaks his leg, why should I pay for it? Well, you got a point there. But when we're talking about something like COVID-19, a deadly airborne virus, then you certainly have an interest in keeping your neighbor healthy. Now, what the state can do about this, the state has a great deal of control over Medicaid and Medicare, and the state controls what types of services in their state are covered and to what extent. So through Medicare and Medicaid, the health systems for the old and for the low income, expanding those types of services and making sure they're funded well and that people have access to them and know about them and can take full advantage. The state can do a lot to promote healthcare, at least among the poor and the elderly. So I don't know if that answers your question or.
Yes, it does. What issues do you see that are very specific to your district that you may want to address if elected delegate?
We've spoken about this before, you and I. Everywhere I go, people talk about I-270. I'm sitting at home now. We're about 2 blocks away from exit 6 on I-270. And we can hear the cars over there. If I step outside, I can hear I-270 from my house. And there are a lot of people who live a lot closer to it. So, something needs to be done to relieve congestion, especially on I-270. However, the constituents in my district are pretty much opposed to widening and adding more lanes to I-270. And that's something that is pretty much unanimous among the people whose votes I need. And I've got to listen to my constituents. Also, people in this district are not very keen on the idea of tolls. They look at what happened in Virginia with toll roads there, roads that are entirely toll roads that aren't used, and you still have congestion on the neighboring local roads, or the system that Virginia has on the Beltway 495 would fluctuate, and Route 66, where the tolls change on the amount of traffic. When there's a lot of traffic, the toll lanes are very high, and people don't use them that much. Also, I'm getting another message that my internet connection is unstable. Also, these companies that operate. Can you hear me?
Yes.
Okay. Plus,
I can hear your music too.
Yeah, I don't know where the music is coming from. Hold on a second. Give me a second. Let me see where this music is coming from. There we go. Sorry about that. I don't know why that just started all of a sudden like that. Anyway, so we're talking about traffic. So something has to be done. I think the state should look into, as an alternative to either adding more lanes or tolls, look into alternating lanes, reverse direction, so that in the morning there are 2 extra lanes heading south on I-70, and then the afternoon commute there are 2 extra lanes going north. And this is done with other roads around the country and around the world, where they, if you have 8 lanes, 4 going in each direction, for the morning commute you have 6 lanes going one way and the 2 going the other against it, and then the opposite in the evening. That's a possibility. There's talk about mass transit along I-270, but I really don't see that, because I-270 doesn't go through where the major commercial areas, the way that the metro does. I would favor, the metro. They've been trying for a number of years to upgrade that. I think that part of the way to relieve congestion in general, particularly on I-270, is to extend the metro, not as the metro, but as a light rail system from the Shady Grove station at the end of the red line here up into Gaithersburg and Germantown. So the idea is you would take the metro to the end of the line at Shady Grove, and then there would be some other system that is light rail. There's not quite as a full-blown metro that would take you up into the towns of Gaithersburg and Germantown, from which a lot of people commute. Gaithersburg is served by the MARC train. The MARC train right now doesn't run 7 days a week, doesn't run 24 hours. They can expand service on MARC. But everybody's not going to switch to public transportation. We have to take care of the roads also. In particular, the American Legion Bridge over the Potomac River between Maryland and Virginia. There was an agreement between Governor Hogan and Governor Northam of Virginia to fix and upgrade the American Legion Bridge. Governor Youngkin came into office in Virginia and he scrapped that agreement. We've got to have an agreement with Virginia to fix that bridge, because it's old, it's not adequate for the amount of traffic that goes over it. We've all been stuck, getting onto the American Legion Bridge from either direction, trying to get over to Virginia, to the GW Parkway or to Tyson's Corner. And it's not just a choke point for the metropolitan area, it's a choke point for the whole East Coast, because when the big trucks come moving north to south through the Washington metropolitan area, they can either go around the Beltway one way or around the Beltway the other way. And if the American Legion Bridge is, God forbid, out of commission, all that truck traffic for the East Coast, the whole East Coast of the United States, is going around one side of the Beltway. They only have one alternative. So I think that's a necessity. It is not in my district, but they began work on the Purple Line. It's held up because of local government zoning. That's been funded. It's got to, they got to continue that project, because I don't want to say it's half started, but it's started. And I think that would do a lot to enable people to get to jobs and get to housing from the west side of the county to the east side of the county. And then there is what they call the Red Line in Baltimore, which is another mass transit system which is stalled, which would help the people in the Baltimore area get around better. So yeah, transportation is a big issue. And I would say for my constituents, I talk about COVID and worker rights, and their questions are always about transportation.
A final question, Joe. Why vote for you? Why do you think you're the right candidate for the job?
I think I'm the right candidate for the job because I'm running on ideas based on 30 years of public service. I'm not on a journey, whatever that means. I'm ready to start working my first day there. I have, as I mentioned, experience with the law, interpreting, implementing, and even drafting the law. I have experience with the legislative process. I'm ready to get to work as soon as I'm there. And I not only need, from my personal experience as a homeowner and a parent here in District 17, knowing what working families need, but from my professional experience, I know how to get it done. I know what works and what doesn't. I've managed budgets, I've managed people, I've run government programs. I've got the experience necessary to use a hackneyed phrase, hit the ground running as soon as I get to Annapolis. And I'll point out, I'm not a career politician. This is the first time I'm running for public office. I really believe that our founding fathers thought that, especially with the legislature, it's the type of thing that when you get to a point in life where you've got something to give back, and you're secure enough that you could take a few years to do it, it's your duty to serve 1 or 2 terms. So, I'm going to serve 1 or 2 terms and then I'm out. Let somebody else do their duty. I think everyone who has the ability, has some ideas, has some experience, should step up for public office, not as a career, not to be a career politician for 30 or 40 years, but do a term or 2 and then go back to whatever they were doing before, retire or whatever. So I think for those reasons, I'm your candidate. And I'd like to make an ask for the members of the Hispanic Chamber of Commerce. If you have a business in Rockville or Gaithersburg, you can see my contact information in the chat, or you can get it from Mauricio. Let me know. I'd like to drop off a sign. If you'd be kind enough to put a sign either in front of your business or in your window to help promote my candidacy, that would go a long, long way to helping my campaign.
Fantastic. Any ideas on how to increase vote participation?
Maryland is really in the lead on that. We have, it used to be the only time you could vote was the first Tuesday in November, between like 8 in the morning and 8 at night. Well, think about your typical family here in Montgomery County, okay? You've got a 2-income household, both spouses, the husband and wife, work, and they've got kids. And the spouses, at least one of them, is commuting an hour back and forth to work each day. Maybe they're both commuting an hour to work. I know that's what happens in my house before the pandemic. And they may be going in opposite directions for an hour each way. And then they get home, and on any given Tuesday, the kids have got soccer practice, scout meeting, piano lesson, all that stuff. And dinner has to be ready, and the kids have to do their homework. And if the only time you can vote is before 8 o'clock on a Tuesday, that's not very family friendly. But that has been addressed in Maryland in that people have the alternative to vote early. There will be a week of early voting before Election Day in Maryland. And also the alternative to vote by mail. So for the primary, all the registered Democrats and all the registered Republicans in Maryland were given an opportunity to request a mail-in ballot. And a lot of people are taking advantage of that. So by giving people more ways to vote, besides just on a Tuesday before 8 o'clock, expands the right to vote greatly. I would like to see Election Day be a federal holiday, so that not only federal workers, but people who rely on them can vote, or make it a requirement that that workers get an extra hour or 2 hours paid leave on Election Day so that they can go vote. But anything that gets more people to the polls is better. I disagree with the Republican Party on a number of policy issues, although I think I'm a pretty open-minded guy. But one thing that really disappoints me is efforts by the Republican Party across the country to make it more difficult for people to vote, when they should be making it easier for people to vote. So yeah, great steps are being done. There's still work to be done, plenty of outreach. I think in Maryland, the idea of getting people to register. Okay, are we back?
You're back. Yes.
Okay. Yeah. I don't know how much of my last comments got cut off, but I think you get
We
the
got to
gist
the
of what I was
part
saying.
where you were suggesting making election day a federal holiday so that federal employees and those who rely on the federal government can actually have the time to vote. And then we lost you at the part where you say that in addition to that, workers could get something else. That's where we lost you.
Yeah, that was their idea is that workers should get an hour or two paid leave. Would certainly be practical for the larger ones.
Joe, you're breaking up again.
But I think
I think you meant.
I would support anything that gets more people voting, gets more people out there.
Okay.
And I don't know if you can hear me, but you're frozen again.
Yes, the connection seems to be unstable at this point. Last part you said was workers to get 1 or 2 hours of paid leave in order to vote. I think we got that through the scrambling of the sound, but I think those are great ideas. And it's been a wonderful hour with you, Joe. The Hispanic Chamber of Commerce of Montgomery County, thanks you for your time. We wish you luck in the upcoming primaries on July 19th. And we would love to have you back after the primaries and continue this conversation.